Walk us through those awkward childhood experiences that you face coming from Poland, being an immigrant, and going in the middle of a very contentious time for our society, Camden, New Jersey, and building who Ursula is today.
Wow, going back there is very emotional because it was very tough. And I almost have no option but becoming the voice of the family at that time. And that feels like I was just made by God to always become somebody else's voice, but then it strengthened my voice, and that's why you're seeing the confident person today.
Ultimately, we will all be patients, because one thing that is the great equalizer is that we will all need help with something in health and healthcare.
Oh my God, I can help so many people that don't know what I did not know, but now I do, and I can share it with them. I truly believe that all those experiences led me to now being a full-blown advocate for seniors.
You are the perfect person to help seniors navigate the very laborious maze of insurance. Welcome to the Bedrock Way podcast, where we're changing the habits of yesterday by creating the new healthcare reality of tomorrow. And Jonathan, do we have a treat for the audience today? We have a treat. I almost feel like we always have a good treat for the audience, because we're always trying to up our game. We're always trying to make sure that every guest that we have is better than the previous guest. And it's that transformative, sometimes I call it that addiction that we have, to strive towards perfection. And although we'll never reach perfection because we're human beings, at least I can die trying, right? And today is one of those days where I'm very, very, very excited to have our guests. And I'll introduce Urszula Kozicki formally in a second, but I want to give a little bit of preamble of why we decided to have Ursula on the podcast. And as everybody knows, the podcast is a way to platform the level of advocacy for everything healthcare related. And ultimately, our patients are our number one advocacy resource. And the reason that we all do what we do is to make sure that our patients have a better life. The title of today's podcast is Untangling Medicare Secrets, Expert Advice for the Senior Living World. And here's one thing that I will say to all of my listeners and the audience that's out there, whether you're a provider, whether you're not in healthcare, ultimately we will all be patients at one point or another. Because one thing that is the great equalizer is that we will all need help with something in health and healthcare. But I always say to people, the most difficult journey that we will ever embark as human beings is the complex journey of healthcare. And unfortunately, most of us take that complex healthcare journey when we're most demented, when we're most vulnerable, and unfortunately, where we're most exploitable. And unfortunately, we don't have enough advocates out there. And that complex healthcare journey gets even more complicated when you don't have the right GPS. So think about it, Jonathan. If you're traveling somewhere where you don't know, or if you're traveling somewhere when you're not feeling 100%, you rely heavily on the guidance to get there, right? Think about the healthcare journey of our seniors. And think about the destination that our seniors have. And think about that destination being taken without a GPS, without anybody guiding them. The likelihood of them getting in the wrong exit occurs. The likelihood of them getting to the destination is probably low. So we brought in today a insurance expert that is going to really decipher for us the insurance and the very tough maze of options that our seniors have. She is an expert at guiding seniors safely through the maze of Medicare options. And again, it is my pleasure today to introduce to you guys the one and only Ursula Kozicki. Welcome to the Bedrock Way podcast.
Hi, Andre. How are you? Glad to be here.
I am doing amazing. We've been waiting for this one, Ursula. We've been waiting for this one for a little bit, a couple of weeks. I know I saw you a couple of weeks in ACNJ, and I said to you, bring it, because I'm going to bring it.
Absolutely.
There was an article that came out. Sandra Bulk wrote an article on Kozicki Life and Health Consultant, LLC, which Ursula is the main principal of, and we'll talk about that during the this discussion, but I wanted to focus on something that Sandra said in her article that really, really was impactful to me. And that is the fact that Ursula has become a trusted Medicare specialist. That's what she does. And she's a broker, and I'll let her tell her story. But as a broker, the distinction is that she doesn't have a vested interest in any insurance payer or insurance company. Her main vested interest in that recipient makes that healthcare journey as seamless and as quickly as possible with hopefully very little collateral damage to their health. So Ursula recommends that having a trusted Medicare specialist advisor is like having a trusted accountant or a doctor. I love that. Just as you're confident that your doctor and accountant have the relevant degrees, knowledge, and experience to treat your illness or prepare your taxes, you can rest assured that Ursula has the education and experience in today's senior care planning, as well as the current state of healthcare, to address all of your Medicare and final expense products needs. And it's true, because that healthcare journey continues to change almost daily. If there's one piece of advice I like to give to my community and neighbors, says Ursula, is to always make sure that the person you're consulting is fully licensed and certified in all lines of Medicare products. Ursula is a licensed independent insurance broker. Her experiences in senior care gave her insight into not only the needs of seniors, but the options available to them. This motivated her to expand her knowledge in the areas of Medicare and final expense product portfolios. Man, Ursula, it is a pleasure to have you, and it seems like you are dedicated right now to empowering seniors. So tell me how that love and that passion began and what brings you, to really that profound message that you have right now, which is our seniors need better options, and you're here to provide it for them.
Yeah, Andre, passion is the correct word you're using here because I'm extremely passionate about what I do. I literally love every time I'm in front of a senior. When did this start? I believe it started when I was actually looking for a place for mom, for my own mother, that was dealing with some physical and cognitive challenges, could no longer live with me. And I remember going to one of the communities asking about, what's the admission process. And I learned that, guess what? People on Medicaid cannot afford those admissions. It was, I cried. I was upset. I didn't know what to do. But then I kind of seen the ad for community counselor. And since I went through those experiences looking for a place for my mom, and I finally actually did find a place for my mom in a wonderful community that took Medicaid on admission, I got that job as a community counselor and started dealing with families on a regular basis because that's basically what I went through. And I knew so many families were not aware what's going on in the senior housing or placement in assisted living. I did that job for Spring Hills, Cherry Hill for a couple of years.
Wait a second. You were one of my colleagues.
I was, but I was there before you.
Okay. We overlapped. Okay.
We overlapped. And I loved every day at work. At the same time, I was going to school and getting my master's degree because I was faced with constantly being exposed to doctors, lawyers. It was pretty expensive luxury place. Totally something I was not, even capable of understanding. Money was not something I had. I'm an immigrant from Poland, so I was not there financially. But I was exposed to those people every day, and they looked at me as a salesperson that just wanted to make that commission and place mom or dad. And that totally I was not about that. I had to see mom every day in that community, right? I had to face her. I had to make sure she fits into the community. So that's what I did. I explained to them, what do you do for a living? When I would ask the son or the daughter, and they'd be like, I'm an attorney. Well, guess what? I have a master's degree of adult education and corporate training. My job is to understand the motivation for adults. I need to understand why mom wants to be in Cherry Hill, or why do you want mom in Cherry Hill? So through that experience, I literally learned the senior motivation, the senior challenges, and I love them even more because I was faced with a person that one day I'm going to be, And I was learning from them the journey that is still in front of me. And that's when the passion and love for seniors became like enormous.
And you mentioned something that was, I think, transcending for you, right? And it seemed like you almost always have had an initiative that if there's a broken system or if there's something that needs to be fixed, you're not okay just watching that broken system continue to function. You're a change agent, right? And I think this agent of change mentality started a long time ago. And I will venture to say it started in 1987. Started in 1987 when you immigrated to the United States from Poland. And think about the transfer trauma. Think about the motivation behind someone, very young, pre-adolescent, deciding to leave their motherland, right, to reach a better tomorrow. And that's what you're doing now. You're creating a better tomorrow for our patients, our clients, and people who don't have that advocacy. So walk us through those adverse childhood experiences that you face coming from Poland, being an immigrant, coming from Poland and going in the middle of a very contentious time for our society, Camden, New Jersey, right? And building who Ursula is today. We look at you as the main principal for the main principal broker for Kozicki Life and Health Consulting, and this, the origin of this company is 2016. I would venture to say the origin of this company started in 1987.
I mean, that's a good point because that's when it started. Everything started. Obviously, back then, we all thought of America the best and possibly the only country in the world that you can come in and become whoever you want. As long as you put all the efforts and work, and you would achieve whatever you dream of. And that was actually me. I am a pretty strong persona. I came here with my three sisters and my mother. And obviously, my mom being older, she never learned a language. She never drove the car. She worked in a West Jersey hospital back then in Camden as a cleaning lady. And me being the oldest, I'm pretty much decided I need to learn this language very quickly. Because if I don't know how to communicate, then I cannot help my family move forward. Well, living in Camden, obviously, was a motivation enough to one day move in Cherry Hill. And I always say one thing, it takes 20 minutes from Cherry Hill to Camden, or from Camden to Cherry Hill. It took me 20 years, but I was able to raise my son in Cherry Hill. He graduated from high school there. So it was an achievement. It was a goal. But funny, when I was pregnant with my son, obviously I wasn't working. I was helping seniors. What I did, I was taking Polish older people to the doctor appointments because they didn't pay me. They gave me $10 for gas or whatever that was. But I spoke English, and I was in Camden. And those poor Polish people that didn't speak English in Camden, they needed doctor appointments. So I was first introduced to Medicare, which I didn't understand back then. I understood that they had the red, white, blue card, and that card gave them coverage for doctors. And for medication, they had a separate card. So it was all just very new to me, but I was translating. And I was helping them get the care that they needed, especially knowing that they're foreigners, they're scared to ask for anything. So as I got better and better and understand, and then later my mom went on disability, I had to take care of my mom. And I gotta tell you, it was the worst thing that I had no advocacy. For years, we did not know that my mother could be getting Medicare coverage through disability until somebody guided me to Social Security office and said that to me. I believe I was in 1920 when that happened. My mom got sick. She got a heart attack in the hospital when she was working. And we paid for everything for my mom. We paid medication out of pocket. We did not know she's entitled to Medicaid. We didn't understand any of this. Until the time I started working in Spring Hills as the community counselor, I was like, oh my God, I can help so many people that don't know what I did not know, but now I do, and I can share it with them. So it's almost like I was, I guess, placed in the right place at right time, and the journey took a huge circle to become what I was made to be, and I truly believe that all those experiences led me to now being a full-blown advocate for seniors. And that comes from Yes, we start off with Medicare. Yeah, I'm gonna go over like how you get Medicare, what's the open enrollments for Medicare, initial enrollments, all those little enrollment stuff. And I'm glad you called it a secret. I call it maze, or I call it like which Medicare could be. For me, it's ABCD. For people out there, what is ABCD? What did I do with the C? What is the D? What is the supplement? Why do I have to have this? Who pays for this? Why can't I have this? So I'm there to answer those questions. And very, very happy that I actually can do this compliantly, making sure that what I educate and consult about, it's actually the factual data out there. I make sure the networks and the providers are available to my population. And being licensed in 10 states now, having New Jersey being my resident state, I have to know everything about New Jersey. And I don't care if it's New Jersey, South Jersey, Cape May, whatever areas, that's my job. So I pride myself of constantly educating myself and knowing. Because when I'm sitting in front of that vulnerable, senior, they're relying on everything I know to be correct. That there will not be no misleading, ways or any kind of my incentive to lead, steer them one way or the other. And that's what I do.
So listen, Ursula, we're gonna have plenty of time during this hour for you to tell my listeners, our audience, what you do and how you do it. But I want to know the why of what you do, because you said a couple of things that resonated with me, and I don't want to just bypass those things. And hear what I'm going to say. You said when you emigrated to America, this was the place that you consider, and I'm quoting you, this is where you can come and be whatever you want.
I agree.
This is where your dreams come true. That's the definition of independence.
It can.
Right.
I mean, I still believe you have to work hard.
Sure.
You have to get yourself out from that wrong side of tracks.
Beautiful.
You have to have the passion to do that and desire.
And that level of independence is what seniors are eager to have. But that's what we take from our seniors, right? We take their ability to choose. We take their ability to have freedom. We take their ability to be independent in the things that they get to have entitlement of. And for you, it hit closer to home. It was your mom.
Right.
Right? So for you, it's become more of a personal mission, to take care of what you called a vulnerable senior.
Yep.
So, but that wasn't created in 2016, 19, 20, 20. That was created, I want to go back to 1987. And the reason I want to go back to 1987 is what you are now is you are a champion of seniors. You are a champion of that vulnerable senior who has lost their independence, who doesn't know the options, who doesn't know how to navigate that maze, and who is really looking for someone to give them that guidance and to be, again, that advocate, that champion. I want to know two things. I want you to walk my audience, because today what I see is a very, very confident, I want to call you a very confident business owner who knows their stuff, knows their craft, and is constantly trying to make it better. But this wasn't who you were in 1987 in a new country, right? You were that vulnerable person. You needed a champion. So I want to take us through the adverse experience of emigrating from a different country, halfway across the world, coming here, and tell me how those early years were for you. Because I want to know, and I want the audience to know, who Ursula's early champion in her life was, so we know the purpose that you have now, how that was created, because that's really your why.
Wow, going back there is very emotional because it was very tough. Like I say, coming to the United States with my little sister, that the youngest was only 6 years old, my mother, that it was a very shy and quiet person. And I almost have no option but becoming the voice of the family at that time. And that feels like I was just made by God to always become somebody else's voice, but then it strengthened my voice. And that's why you see in the confident person today. Just literally learning everything about, education system, healthcare system, all of those systems, a new culture, the language itself. I mean, you can translate a word by word from one language to another, but getting the concept how to say things, sometimes they came out wrong. Because I was just literally learning how to not only learn the vocabulary, but put it in a full sentence that actually made resented with people the correct way I try to say. I mean, often I heard, and that's a funny thing, they say, "You're so funny." And I said, "Why you say that?" And they will say, "Because you say it the way it is." What the only reason I said it the way it is because that's the only way I knew how to translate into English language. Obviously, 37 years later, that's no longer the barrier. I can, kind of relate with anybody. But learning the healthcare, it was horrible. I didn't, in my country, when we were growing up, you go to a doctor, you go with your parent. Here, you needed to go to a regular doctor with your parent, but going to like a female doctor, you didn't need a parent. And it was like weird for me because I'm like, we go to with our parents everywhere until we're 18. You had the freedoms here of, making decisions as a young person, but really, do you understand? Did I understood the decisions I was going to make for myself? I needed my mother. Well, here's my mother not speaking English, and I'm translating what the doctor is saying about me to my mother so she can say yes or no to it. So it was a constant learning on the differences, the similarities. But I think that's basically when my passion for overcoming challenges and making me grow and succeed by learning. And every day I still learn. I mean, even 37 years later, I'm learning.
So who was your champion
My champion?
back then?
I mean, not a person. It was, I guess, faith and strength, internal strength, believe in myself, because we didn't have anybody that was going to guide us. There was not a, advocacy agency. We didn't drive. All the Polish things were in New York or Philadelphia. We lived in Camden. Like, there was nobody there really guiding us as a family to the options, opportunities, etc. So I needed to learn everything step by step from experiencing. And I make a lot of mistakes.
Right. I think your champion was your mother.
Okay.
Whoever decided to bring you from Poland here, which I think has been at the benefit of us, because having you as part of our society may be Poland's detriment, but definitely our gain. And I give your mom credit because I
never seen it that way. Thank you for telling me. I mean, now she's gone, but
you said it was
she
three.
did.
It was three of you, right? 6-year-old.
No, there was actually my mom and then four of us.
So
I
tell
was
me
the
ages.
oldest. I was 14. My other sister was 13. Then the other one, born in 81. So she was 6 and 5.
Because if I look at the ages of 14, 13, 6, 5-year-old, last time I checked, none of them are able to immigrate halfway across the country, halfway across the world, even in 1987.
Yeah, my mom took really like
Right.
She left the comfort zone of her country, even though it was a communism and whatever have you, but she lived there all her life. And she did it, sacrificing her life to give us a new life.
Yeah. And that's what I see in you. What's your mom's name?
Maria.
And I see
gonna make me
Maria.
cry.
Maria's your champion. And I see Maria talking to us right now. And I think you should be very, very proud of what you have done for Maria.
Yeah, we took care of my mom. She took care of us, sacrificing her life, but when she gets sick, we gave back to her, all and every one of us, every single day.
Because-
And I was the insurance carrier. Like, nobody in the hospital could have touched my mother without me knowing what they're doing.
Listen, that's what she taught you to do. And she taught you to do something, and then when it came time for her to be able to get the merit of that, those teachings, you guys delivered. And the reason I wanted you to tell your story, Ursula, and the reason I wanted to know your champion is that you are the perfect person to help seniors navigate the very laborious maze of insurance. Think about what you navigated as a young 14-year-old, being the matriarch of a family at 14 years old, right? And being in a new country, new customs, new language, new culture, new way of doing everything, and at times almost being discriminated against, right? Because
absolutely.
you came in, to a place where the demographic was you were the scarce demographic. You were the unknown demographic. You were not part of the majority, is what I'm saying, and that takes a tremendous amount of courage. That takes a tremendous amount of resilience. That takes a tremendous amount of day-to-day telling yourself, my mom, my champion, made this sacrifice for us, and I'm not going to let that sacrifice, result in anything in vain. I'm going to make it worth her while. And so you've taken that navigation of the maze of just America, and now you've translated that. Think about it. You're not only translating a language, you've translated that navigation as an early individual, as an early immigrant, to now help seniors navigate their journey. And I couldn't think of a better person that can help someone navigate their very complex journey of healthcare than someone that has gone through their own journey. Amazing. And you add to that, you're a mother yourself.
I am.
So not only was your champion your mom, you are a mother yourself, right? So that maternalism and that ability to be that guidance of people, it's almost just inherent to you. And I think that's why you're so good at what you do.
Second nature.
Exactly. It becomes second nature. All right, so now that we kind of got a little more context of 1987 and how you came to be today, I'm always very, very enamored with how people grew up, because again, it gives us a look into their soul. And I love the fact that you put yourself out there, because it gave us the opportunity to understand, wow, this is a pretty cool individual that we have in front of us. Someone who has a tremendous amount of substance and that can really help us, and somebody who ultimately cares, right? Because in insurance, it's very easy to make money. Right, we talked about it in the pre-screen. There are residuals, there are commissions, there are bonuses, whatever you name them. And it's very, very, very easy for the very sophisticated talker to bait and switch a senior, right? For the very sophisticated senior to make a ton of money and pretty much give a senior worst insurance that they had. But the reason I wanted my audience to get to know the sincerity behind your words, to get to know the person behind your words, is because I want them to now listen to the message. This is not just any other broker. This is not just any other person selling insurance. This is the broker. This is the person who cares. This is the person who has gone through it. This is the person who this has been their way of life. And now when you know the person, Ursula, you tend to listen to their message more, because now you're one of one. So now let's fast forward to 2016, where you now said to yourself, you know what? It's time for me to go out on my own as a consultant in the senior community and become an independent consultant so I can help seniors choose their insurance plan. And you mentioned you were your mom's insurance manager advocate back in 2020 when she passed, correctly? So walk me through that 2016. So you were a community counselor at a senior living community, one of the best in the region, by the way. That's no bias there. But you use that as a way to say, hey, there is a void here in the industry. There is a void here in helping seniors, and I'm going to fill that gap, at least as best as possible. So take us through your next journey from 2016 and where you are here. That's the first thing. And then second, what makes you different aside from your background?
So, yes, thank you. And I'm going to allude first to the amount of money we make. And we are actually encouraged to tell my clients, and I always tell my member when I'm sitting in front of them, I make great money helping you and assisting you, but I'm going to make even more money if I do things right by you, because that's how I'm going to keep you in my book of business. And I work for you. I don't work for the insurance company. I get paid by servicing you. So that's why I'm always available for phone calls, answers, text messages, whatever. My members know they have a speed dial line to talk to me when they have questions. Going back to 2016, like you said, I was in the corporate world. I decided to go on my own and build something for myself as a legacy so I can one day leave it to my child, if that's at least the purpose of doing something in life in general.
If he chooses to follow mom, right?
If he chooses to follow mom. As a matter of fact, he is a licensed agent himself.
I'm not surprised.
Yeah, I told him, boy, you're going to sell because that's all you know. Although I don't sell, I consult. My product is not something I can sell. It's not, a desire or need or want. It's a need. So when I started in 2016, obviously I had to learn everything about Medicare, and it was as complex and as horrible for me to grasp on as it is for a regular member going to Medicare. But years of practice, obviously, credentialing, getting AHIP certifications, which is the America Health Insurance Plans certifications. The higher you can get, the highest you can get. Without this, you cannot offer all parts of Medicare. I did this, and then I started to certify with other carriers slowly at once, just the popular ones. Currently, I offer everything that's available in New Jersey, carrier-wise. And I started helping seniors. And the first time I sat down with seniors and, they were asking questions and I had no answers because I didn't ever seen those questions before. I knew A, B, C, Ds of Medicare, but I had no idea how to place them to the individual aspect of my member sitting across from me. Obviously, practicing got me better and better. And now when I come in and I talk to my seniors, I sit at the kitchen table, I ask them questions, I do need analysis, and I make sure that the relationships that they have with their doctors are going to continue even after I leave their house. I will match the doctors with the plan. I don't consult based on, here's a great plan, take it. Here is a best plan that fits your individual needs. From doctors to medications to dentals. If dental is important, then dental is going to be there. But I need to listen before I talk. So that's how I do it. And I care because they all become my grandmothers and, my missed mom now. They are on a, personal basis with me. Hey, Ursula, I'm going to get colonoscopy. What should I expect? That's one of the types of phone calls I get on a daily basis. Or I got these documents, I don't know what to do with them. And I'm there for that purpose. But it's also even deeper when you go into maze of Medicare. It all depends on the individual situation. I mean, just because you turn in 65, that doesn't necessarily mean I'm going to say, go get A, B, and then let's go with a supplement and a Part D, and you're good to go. Because for that person, turning 65 might totally means nothing in realm of Medicare. I might say, look, if you're working for this company, you still get an insurance from a company, why would you enroll in Part B, unnecessary paying $174, this year's $174.70 every month if your employer's insurance is still going to be this primary? Why spend money and throw it in the trash? Do something else with those money. So today's young or older Medicare recipients, the members, they still, even though they're 70, they might be working. There's so many things that's happening because we know the inflation and all that stuff doesn't let them just retire the way they used to retire 20 years ago. Pretty, happy and safe and secured financially. Those members today are in a different situation. Also because of the new generation, a lot of 65-year-olds, they got married later in life. They didn't save money. They're probably still paying off maybe the child's college or second mortgage because they were taking care of their parent as a sandwich, society that we are today between our teenager kids and our parents. I mean, we're turning 65. We call them the young 65 or the young Medicare. I always tell them you're young. So I have to really put their lifestyle together with the medical needs and desires and adequately presented them with their options. My job is to consult. I cannot tell you what to do. I don't get paid better by enrolling you in this plan or the other. To me, it doesn't matter. The compensation is great, but it's at the end of my job. Like, my job is first to help you. Make sure you have this trusted advisor that every time something happens and, situation, health risk, hospitalization, that you are always aware of what to expect and how to advocate for yourself in front of the provider or the hospital. Because if you're an educated consumer, even in the healthcare realm, now you're becoming that much of a beneficiary of what's available to you out there, right? We both know that. So that's what I care about, educating my members so they can become their own advocates and pretty much be in the right plan, but also understand why and how that plan or that option, Medicare option, will work for them.
I love it. Listen, listening to you speak about insurance is pretty fascinating. So I did a little research 2 years ago, Ursula. The number of insurance agents, brokers, and just service employees that cater to this need in our seniors is over 1.2 million. I would venture to say that out of those 1.2 million, there's a very small fraction of them that speak about this the way you do. Very small, that have this passion, that have, I feel it resonates. And the article that Sandra Bulk wrote about you, Guiding Seniors Safely Through the Maze of Medicare Options, she mentioned something that really resonated with me. And I wanted to mention it to the audience because I think it's impactful. She said, your philosophy is that there is a fiduciary duty to help seniors and other Medicare recipients understand their options. You bet. And you quote, knowing my members are confident that I will always respond to their inquiries, address their needs, and just be there for them is what I love the most. I love that. Because ultimately, you're right. You can look at an insurance broker agent can look at someone as a number, right? A means to an end. You're an application. I make $728, give or take. I make 10 of those. I do the math.
Right.
But you're again, for you, this is more than just the money. For you, it's become a way of life. You also have a passion for providing your clients with comprehensive knowledge in a way that they can understand in order to make sound, well-informed decisions. And what you just said is so unbelievably profound, and I didn't even think about it. You're right. Navigating healthcare is so laborious in itself, but navigating healthcare where you're socioeconomically challenged at a later age is even more daunting, right? And I equate it to the complex health journey, right? You don't have a GPS, so you don't know where your destination is. You don't know how to get there, and you're running out of gas. Think about how you feel when you're going somewhere. You don't know where you're going. Your GPS just, your phone died, so your GPS is not working. Your gas tank is on empty. Like some of these bank accounts of these people, because they're on fixed incomes, and they have to make decisions about how to take care of themselves.
And they panic.
Of course. And you mentioned the most satisfying part of the job for you is educating people.
And that is exactly, and I will stand by it in a court of law if I have to. I love when my members are smarter with each and every conversation we're having, that they know that they have services available to them, that they should have a conversation with a social worker before being discharged from a hospital. So they're aware of it, that this is part of what is covered under their Part A, Part B, or the supplement in addition to it. That they have ability to get more, like they have the dental, they have the vision, they have an option to build almost kind of find a plan that's built just for them.
Yeah.
You know, I'm not throwing words of Humana or Aetna or any other carriers out there, Cigna I need to know that plan is just for them.
Yep.
Because it's going to take them where they want to go with the finances that they have at hand without panicking that they're going to run out. And then, it's beautiful whenever I learn something new, like Inflation Reduction Act that has been lately implemented yearly. There's a lot of changes, but 23, 24, 25, we're getting changes that are going to only help those people. I get excited about calling my members and saying, listen, come October 15, you have to call me because there's new things coming up. I can't talk about them until October 15th, but I want you to definitely reach out to me because it will benefit you. Because I got to tell you something, Andre. I don't really know the number of my book of business. It's somewhere in the hundreds out there. But if they call me, this is Miss Rose from Violent. This is Mr. Rick from, I don't know, Willingboro. I have them in my phone, simply like that. Miss Ann from Sister Jenny. So I remember. So when I pick up the phone, I'm like, hi, Miss Ann. And they're like, how you know it's me? So I have you in my phone. Like, I know my people, they're family. I know what they like, don't like. And it's that's why numbers are not what I am about.
But listen, let's be honest. When you are able to provide this much needed service with passion and understanding and dignity and compassion and enthusiasm, the money comes.
Oh.
The money chases you, and you say something, I'm sorry.
The money is a reward. It's just on
Exactly.
But
Exactly.
it gives me great lifestyle.
Exactly.
I got to tell you that.
Well, listen.
They pay me well.
And you deserve it. And I think
Thank
you
you.
deserve it. I think I've always said something, Ursula, and I'll say it again. There's no shame in making money in healthcare with seniors, in senior living, if you do it right.
Absolutely.
And again.
And you know what? Just to stop you there, my seniors constantly ask me, but you're not charging me. How are you getting compensated? They want me to make money.
Sure, because they see value.
And they're so happy that I'm getting paid.
Because
They're
they see
actually
value.
happy.
I think what we have become as sometimes with seniors is that we all become financial advisors. We all become social workers, and we all want to manage our seniors' money, because again, you got the post-depression kid who is very frugal, and they've lived through again very hard times post-depression. But what I always say is seniors, and this goes for everybody. Let's focus on seniors now. They will pay for anything that gives them value. That's it. So this article continues to say that for you, meeting a client who is confused and lost in the maze of Medicare rules, and at the end of the conversation, seeing them at ease with full comprehension of their options, it's what makes your whole day worthwhile. From Medicare open enrollment to retirement or losing employer coverage, Ursula is fully versed in all the available insurance products. She listens to each client with compassion, understanding, and the wisdom of experience so she can address their unique situation and needs to put their minds at ease. Because for you, serving people is always your first priority. And if people want to know, your consultations are free, and they're free, but you're deeply rewarded and well compensated, secure in the knowledge that we provide outstanding service to help our members. I love that. And if people want to reach out to Ursula, they can reach Ursula at Kozicki, Kozick, Life and Health Consultant LLC. We'll link it out when we have the podcast. Ursula's office is located in Marlton, New Jersey, and we will also link out her number and her email address so our audience has it. And based on your wisdom of experience, I wanted to kind of just pivot here a little bit into two things. What are the toughest questions that seniors have when it comes to their insurance that you're like, if I can somehow put this on television and make it easier? What are those questions? What are those questions that you're like, everybody should know this. Everybody should know these questions, but it seems to be the toughest things that people can't overcome. What are they?
Oh, gosh, there's so many. But you know what? The most one I heard, and I hear this from my members or the new clients I'm meeting, as well as providers. Everybody's confused in one thing. Part C of Medicare versus supplement. People think B is a supplement, which is not. People think C is a supplement, which is not. They think ARP is different than United Healthcare, which in essence is, but it isn't. So I would like everybody to understand one thing. There's 4 parts of Medicare. A, and I always think of it this way, A is a building. That is the coverage for hospital, hospice, rehabilitation. B is people. It covers doctors and labs. D stands for drugs, so it's a standalone prescription coverage. And a C is that buffet that takes all of the A, B, and D into one. So C, even though it's right there in the middle, it actually kind of wraps around the entire option into one plan. So now that B, right, that they confuse as a supplement, it's not, because B is just a part. And your C becomes managed care or Part C of Medicare, which is the same word. Here's the difference between the supplement and Part C. Supplement is a private insurance company that supplements Medicare. They are not contracted with Medicare. It's a private insurance company that only supplements the 20% that Medicare doesn't pay. Medicare Advantage becomes the manager of the original Medicare Part A and B. Then, therefore, it's only PPOs or HMOs. In general, those 2 options are the most widely. And we cannot say that one is the same as the other. Because supplement and Part C of Medicare or managed care, it's a private insurance company that now is contracted with Medicare, serves as a manager of Medicare, and it's not secondary or primary, it's just is. That's the card we present. So that is the biggest confusion.
I'm gonna unpack that a little bit, right? And because I want you to, because it is complicated. So I'm gonna unpack it, and you tell me if I'm doing it correctly. So there are 4 types of Medicare plans.
4 parts of Medicare.
See, this is what I like that we're doing this. So there are 4 parts of Medicare. Part A is your institutional part, which is hospital, inpatient rehab, and think about, like you said, a building, something that takes place in an institution. Part B is your outpatient benefit, which is your doctors, your outpatient therapists, and people that, and labs, right? So
Correct.
things that you go and you kind of use your own transportation, but they're pretty much day to day. Your Part D is easy. That is your drug benefits.
That's the only one that's easy. It stands for drugs.
Drugs, which is prescription. And then the complicated one where a lot of the, I think the confusion and ambiguity exists is your Part C. So Part C is better known as supplement.
Nope.
Okay, so walk me through. So supplemental Medicare, managed care. So let's walk through Part C.
So Part C, you're going to say Part C of Medicare or managed care.
Okay. So
Medicare Advantage plan.
So Part C is the Part C of Medicare is a supplement or a Medicare Advantage.
Never say a supplement. It's not a supplement.
Okay, so it's a Medicare Advantage.
Medicare Advantage or managed care.
Okay, so Medicare Advantage, managed care, and is it a supplement of A and B?
No.
Okay, so
It becomes representation of A and B.
Got it.
So those 2 parts, A and B, are not basis for the C, but C it covers, and A and B, the original Medicare card, stays underneath it.
And it covers the 20%.
No, it does not cover 20%.
So what would be the incentive of someone like a senior to have a supplement, a Part C, whether it's Advantage or managed care.
And again, let's not use the word supplement because that's what gets people confused.
Okay, so
So if they chose the option of going to Part C as their
Primary.
healthcare option, it becomes a only card that they have in their hand. They show it going to nursing home for rehab, or they go into a hospital, or they go into a drugstore for their medication, or they go in to see a doctor or having x-rays. It's the only one card. They often are being asked to show them the Medicare card, the red, white, and blue, but you do not. You have it in your wallet, but you don't take it out.
Okay. So here's what I wanted to do this. Here's what I want to do this. The reason that I want the audience to understand the 4 parts of Medicare, A, B, C, and
Oh, absolutely.
because right now, again, I think I'm pretty intelligent, but this is confusing to me, and thank God I don't need it. But if I am that prospective 64-year-old that is turning 65 in a couple of months, I need to know that Part C really well. Because I think Part C, Ursula, and correct me if I'm wrong, that's where a lot of people get confused and sometimes get manipulated.
Correct.
Right, into doing the wrong thing. And as you mentioned, that Part C, if it starts representing your A and B, you might lose your doctor, right? That was seeing you.
Absolutely.
You might lose coverage, into
Absolutely.
something you thought, and you might end up paying sometimes more and sometimes not saving anything, right?
And you might actually lose the entire network of doctors in your area.
So this is why I wanted to do that exercise, because if I'm confused, then think about a senior who is vulnerable, who is demented, who is isolated, who is socioeconomically easily exploitable. It's going to be very easy for someone to make the wrong choice.
And I got to tell you, it breaks my heart when I see that 65-year-old making a decision on his own, just grabbing the book of Medicare, and it's there. But how you assessing that Part C as an option? Are you going by the premium? Or are you going by just the fact that the doctors are there, but you don't know what the copays are? Or you just simply calling somebody that you're never going to meet in your life and basing your life alternating decisions sometimes for at least that year, once you lose the election period, by somebody who just takes an order because you want to be in this plan, and they just take an order and they sign you up. If you're not understanding sitting in front of a person, like this are your options with this particular Part C, whether it's a PPO or a HMO, they need to be convinced that this is fitting them.
Absolutely. Listen, I will say this to the listeners, and I'll say this to you. Part C to me, and as I look at the C, there's another C word that we would never go in unprepared. And that's a court of law, right? You would never go to a court of law without representation from an attorney.
Correct.
Right? You would never go to a court of law without an expert who knows the rules, who knows the legislation, who knows how to litigate, and who's going to advocate in your best interest. Because if you go in there by yourself, the outcome is going to be very adverse in your favor.
Painful.
And I think the reason that you don't do that, another C word, is because the system is very complicated. And it's very easy for someone who's more knowledgeable than you, right, to confuse you. Another
Absolutely.
C word. So I really implore, and a call to action to our seniors, that if you are someone that is either approaching 65 or are 65 and older and are unsure of really the benefits and the options that you have, give Ursula a call. Contact someone, have someone advocate for you, because as you guys can imagine, and we're proven to you here on the podcast, it's an area that requires the level of expertise that Ursula has gone to school to train for and gotten a license. So just like I wouldn't go to court, with a representation that has trained to represent me. Don't go about getting Medicare coverage without the proper representation. Because what people do is they pick the plan that is cheapest. They pick the plan that's going to give them the less amount of monthly charges. But in the long run, it might be the one that gives them the most financial headaches.
That's true. And sometimes they actually, because they're smart, and they actually don't pick the cheapest one, but they pick the one that's a PPO that's, let's say, $275 a month, which is an old plan that nobody even enrolls in it. And the benefits are horrible because there are newer plans at $40 a month that will be so much better. So when it comes to Medicare Advantage, Part C of Medicare, I totally agree with you. Going to court without an attorney, it's like picking up your plan without a Medicare insurance specialist.
You're doing yourself a disservice. You're doing yourself malpractice, and then you are, again, if you have crappy coverage and you haven't had the right representation, you only should blame yourself, not anybody else. So, I wanted to, since again the podcast is Untangling Medicare Secrets. I think we've untangled some, but I wanted to make sure that if I am let's role play a little bit. I am, my 65th birthday is coming up in a couple of months. I am hoping to retire at the same time. I have a good pension. What are some of the things that I should be doing right now, Ursula, to make sure that I get the best coverage for myself? Is there an Ursula prescription of 4, 5, 6, 10 things that every senior should be doing right now to prepare and to make sure that they make the best decision for themselves?
So, I mean, the process starts with and when you want to retire. And obviously, let's say for the purpose of this scenario, your birthday is in July and we are in April. This is a good time to call Social Security office and schedule an appointment with them, or set up your online Social Security account and enroll in Medicare, original Medicare Part A and B as of turning 65 in July. So you will be effective July 1. Once you get that done, because we want to do it 3 months before your birthday, the month of your birthday, 3 months after your birthday. But I'm going to tell you, please do 3 months before your birthday, or otherwise you're going to be waiting for your card much longer than needed, and we won't be able to help you moving forward. So then the second step is, now what do I want to do? Do I want to have a freedom of network? Do I want to have flexibility? Do I want to choose my own doctors whenever, however? Do I want to have referrals? Am I comfortable having no dental? Am I comfortable having network? What is my healthcare lifestyle? Who am I as a person? If I like to fly to different states for the best possible specialist, you obviously not going to do well with Part C of Medicare. You could, but not necessarily as easy as if you will go with the straight Medicare and a supplement. So you got to learn. You got to share. And then give me a call. That's another best thing you can do. Simply because then I will kind of either help you understand why you're doing this or guide you into based on your lifestyle.
So I'm going to paraphrase the prescription because I love it. The prescription is, when do you want to retire, right? So that should be your first order of business, or when do you want to make sure that this is going to kick in? First step is, if your birthday is in July, approximately a couple months from now, make sure you call your local Social Security office and make sure to enroll in A and B enrollment, A and B coverage, Medicare Part A and B coverage. Then I think the most important question that you have to ask yourself before you call Ursula, which is your fifth step, is, what is my healthcare lifestyle? I love that. What is my healthcare lifestyle? Because you're right. My healthcare lifestyle, which takes into account your healthcare status, your level of activity, you almost are betting on yourself, right? If I have a healthy lifestyle, if I eat right, if I don't have a lot of stress, if my socioeconomic status is really good, if I like to travel, have a spouse, if I don't take a lot of medication, blah, blah, blah. If I'm pretty healthy, then I can really take risk with being flexible, right? I can have flexibility. But if I don't have that if my lifestyle is a little bit more, I just want to be a homebody because I got some chronic disease issues to deal with, then I might need to look at what is the best Part C option for me potentially, so I don't lose my shirt if I have a costly hospitalization or exacerbation of my disease. Let me ask you something, Ursula, because I know that one of the biggest things that I know are misconceptions, and I think, again, we're untangling secrets, we're creating a little bit more clarity and hopefully minimizing the ambiguity. But one thing that I always, that people always misrepresent is the open enrollment option. So tell our audience how open enrollment works. And I think sometimes people tend to think that once they make a decision, the decision is done. And maybe it is. But can you give the audience a little bit of clarity on what the open enrollment means and the flexibility they have around open enrollment?
Great question. Great topic to dive into. There is something called initial open enrollment. There's something called annual open enrollment. There's something that called open enrollment for Medicare Advantage only. And there is also open enrollment for supplement. Each one of those open enrollments will mean something different and will be used in a different circumstances. So the most known by open enrollment is the annual open enrollment, which is for anybody on Medicare between October 15 and December 7. Anybody, regardless of if they're straight Medicare or if they're Medicare Advantage or if they're, just Part A with Part B, they can make changes during that particular time. It's 10 weeks kind of period. 7, but we can discuss it since October 1st. Start signing up since October 15. That is your most important open enrollment. It's the annual one. To you, though, turning 65, the initial open enrollment might be very important because you literally are turning 65 and you have some time to sign up or pick an option. For the supplement, you will have 6 months. For the Part D, you only have 63 days after turning 65 if you don't have a comprehensive coverage.
So let's say I go through my initial enrollment and I pick, and I don't use an Ursula, or I don't use your services. I turn 65 in January, and then I find out that a lot of the doctors that want to see me or that I want to see don't want to see me. What do I do now?
Well, they will see you if you just have your Medicare.
What if I have a Part C that they don't accept?
Right. So now, within the first 6 months, you're still within open enrollment to drop and pick up supplement to supplement your Medicare. Now, let's say it's September. Now it's 9 months. You can still do that. Under special enrollment, I am in Medicare Advantage for the first time, and within the first year, I would like to make a change. But now you have a guarantee issue to pick up a supplement. What about if it's now January 15th of the next year? You're staying with that Medicare Advantage. Now, you just found out some bad news, and you can't find specialists because your situation health-wise changed. Now I have to do underwriting because now you want a supplement now. You're telling me, I want a supplement. They told me to go with this one. I made a mistake, but there's nothing I can do because on that supplement, you passed your initial open enrollment. You passed the special enrollment of trying Medicare Advantage for the first time because it's already 12 months in.
Sure.
So now you're pretty much going to face this. I'm going to ask very, very deep questions that are on the application for that underwritten supplement. And chances are you might be declined the coverage. And you're stuck with where you are, that you made the decision without consulting initially.
The last question I have for you is, what is next for Ursula? You've accomplished so much, but it seems like you've just started your journey and your purpose. What is next for you?
Well, definitely try to dive in deeper in changing the way insurance or insurance brokers are being perceived. We're not the money-making, taking advantage of seniors. I want to be a partner. I want to be a partner with the providers. And I think we have a common interest. value-based care, it's a word that comes more and more and more and more into a kind of surface. And what happens is more and more providers are understanding and learning about it, but that's where the Part C comes in. Because fee-for-service, original Medicare with supplement, it's not going to be value-based care, contract, But it's so much education that's still needed out there between the insurance payer, the insurance broker, who's the middleman conveying to a population out there, Medicare population, and the provider who gets paid for services rendered based on creating better healthcare outcomes.
I love that we come full circle with Part C, because it's exactly
Right.
how I decided to end the podcast. And because I think Part C is really what represents the topic and what represents you. And we started the podcast with talking about, what distinguishes you from everybody else. And as I heard you talk, I'm gonna iterate the word, the letter C. Confident, someone who has a tremendous amount of courage. You are very candid, right? You tell like it is. You said you used to tell like it is. No, that's how I talk. You have capitalized really well. You convey the message. You communicate the message. You are consistent. You collaborate very well. And I think the biggest thing is you care. And I will come full circle to Maria. She taught you how to be a champion. And today you are a champion. And I think, again, in the irony of Part C for you describes you as a champion. You provide people what they care about, what they should care about the most. And you mentioned this so well, things that people value. And people value feeling good, taking care of themselves, and making sure that, others look to them, and not in a way to exploit them, but to help them, right? Absolutely. And I think you go back to 1987 when you came here and you saw that others helped you, right? Or when others wouldn't help you, you remember those that did. And I think for you, you carried that legacy of yours to now be that champion for others. And I think you're doing an incredible job. I hope that your book of business this year, this time next year, is in the thousands, because you deserve it. Because someone like you should continue to do very, very well. And I have a feeling, Ursula, that with Bedrock helping you, you're going to do very, very well.
Thank you so much, Andre, for the opportunity, because this is a voice I wanted to share and through your channel, and I watched all your podcasts, and I know that we think the same way. I literally know that we think about the quality and the outcome before we do anything for the fellow seniors out there that just need people like us. They need it. So thank you.
And with the spirit of the Part C and the letter C, I concur. And we are changing the habits of yesterday by creating the new healthcare reality of tomorrow. Thank you so much, Ursula. It's been a pleasure.
Thank you so much, Andre.